It is actually on your, so right here on your calendar, see it says new vocab words for the week, and it's words 23 through 42. Those are your new vocab words. Okay. So those will be your new vocab words, and that's 23 through 42. And your vocab test is going to be on Thursday. So today, of course, we're going live. We're going to go over chapter 5 and 6. Y'all are going to do your homework for 5 and 6 in your book and workbook. OSHA training video, the link is below. Do you see how it comes out to the side? Well, you're going to need to click on this box and then just go to that link underneath. There's an OSHA test. It says that it was emailed to you, but I also, I put it in your binder for sure. And it's test A. It will say test A and test B. Have y'all found it yet?
I've looked and I can't find it.
I can't find it anywhere.
Me either.
Because I made everyone copies and put them in your binders personally.
Is it at the very, very back underneath the notebook paper?
It is.
Found it.
Yeah, I found it.
That's where I put it. Awesome. Yep, that's where I put it. Did y'all find it now?
Yeah.
Okay. Yep. So after you watch the video, you'll take test A, test B, and then just scan it into you. So this, where it says case studies on Evolve Interactive Dental, okay, what you're going to do is you're going to go over here to resources, click on resources, go to student resources, go to Interactive Dental Office, type in your name, then at the top where it says patient case study, you'll click on that. And let's go to Mr. Brooks, Greg Brooks. Greg Brooks is a 35-year-old man who doesn't like going to the dentist. His wife has finally convinced him to see a doctor. I want you to hover over each one, and I want you to pick, and there's several, okay? There's several here. And I want you to pick 5 patients that, like this woman right here, Jessica Brooks. She's 29 years old and she's 6.5 months pregnant. Okay, so her condition, because today we're going to go over, emergencies or things that can happen like in the dental office. So I want you to put, okay, she's 6.5 months pregnant. What do we have to be careful of? Can she have x-rays?
Nope.
No. So let's go to, and just hover and look over your patients. He has a medical history of hypertension and high cholesterol. We need to know what precautions we need to take for him. Okay. So that's what I want you to do, is to go and look at each patient's illnesses and what the protocol we would have. And you'll have to Google and do a little research, okay?
Are we turning in anything on that or no?
Yeah. Yep.
Okay.
Pick 3 to 5 patients and then send that in to me.
Like what their medical conditions are and what precautions we take?
Right. Like
Okay.
patient, yeah, who the patient is, what their medical condition is, and the precautions we take. All right. So let's get into chapter 5. Excuse me. There we go. Okay. Am I still recording, guys?
Yes.
Perfect. Okay, good. All right. Disease transmission. All right. Pathogen. Pathogen is a microorganism that is capable of causing disease. These microorganisms are so small they can only be seen under a microscope. Pretty small. Bacteria are a large group of one-celled microorganisms that vary in size, shape, and arrangements of cells. Most bacteria grows best at 98.6 degrees in a moist, dark environment. That's why most of your dental offices are cold. Doctors' offices are cold, you know. So, and a lot of your dental, well, you know what? Used to, in the dental office, we would offer a blanket to a patient if they were cold. Now, I don't know if that's something that we can't offer anymore because of COVID. That's something I'll have to research on. A bacterial infection can be spread by many means of transmission. Humans host a variety of bacteria at all times. The variety of harmless bacteria that we have is known as normal flora. But if we do have, an infection from bacteria, an infection occurs when bacteria invades one part of the body, enters one part of the body, invades another, and becomes harmful. Most bacterial infections can be treated with antibiotics. When viewed under a microscope, bacteria have 3 shapes. And up at the top of 55, it shows you the different shapes. You have the rod shape, the spiral shape, and the spherical shape. And it tells you what each one causes. So like the spiral shape, that's going to be syphilis, which syphilis is a sexually transmitted disease. Lyme disease come from ticks. Rod shape is TB, tuberculosis. Tuberculosis is airborne. TB. So if I had TB and I coughed in an airplane, I probably just infected everyone. It's like having the COVID. And it does. It affects the lungs. And then your spherical shape is strep throat, pneumonia, boils, skin infections, pneumonia. So those are your different types of bacteria shapes. Spores. Under unfavorable conditions, some bacteria change into a highly resistant form called spores. Tetanus is an example of a disease caused by spore-forming bacillus. Spores represent the most resistant form of life known. So when we get into clinic, I'm going to show you, there's a test that we do on the autoclave. And the autoclave, anything that has gone in the mouth would go through sterilization. And there's a sterilizer called an autoclave. And once a week, we have to do a spore test on that to make sure that it's killing the spores. But I will show you that in extern. In fact, we will get into that in chapter 7 and 8 again as well, the spore test. Viruses. Viruses are specifically smaller than bacteria despite their tiny size. Sorry, guys. Despite their tiny size, many viruses cause fatal diseases. What is a virus that can cause a fatal disease?
Pneumonia.
I was thinking more like HIV, COVID. Those can kill you. Pneumonia can too. Don't get me wrong. Yes, yes, yes. Yeah.
Oh, the flu.
Yeah,
The flu has killed more than COVID.
this is true. This is true. Yep, this is true.
It's just not reported, but that's a different story.
Johnny. Johnny, are you having a bad hair day today?
Oh, you don't want to see what's under this. Yes. I woke up like one of those blue little dolls. What are they called? Like their hairs are just like all the way up.
Trolls.
The trolls, yeah. I woke up with the troll head.
That's funny. I was like, I know he's not cold. All right, latency. Some viruses establish a latent dormant state in the host cell. A latent virus can be reactivated in the future and can produce more effective viral particles followed by signs and symptoms of the disease. So someone might, have HIV, but they don't know because they're not showing signs or symptoms. It's kind of laying dormant. And then 5 years later, they start getting sick, and then it's, so they might have had it and just didn't know it until signs and symptoms were shown. It was latent. Viruses can cause many clinical significant diseases in humans. Unfortunately, most viral diseases can only be symptomatically treated. So, like HIV, they can take antiviral drugs, but they can't get rid of it. They'll always have it. Hepatitis B, once you get it, you always have it. I'm not sorry, guys. We get vaccinated for B. Hepatitis C. If you get hepatitis C, once you have it, you'll always have it. It can be treated with medication, but you'll always have it. All right, fungi. Fungi are plants such as mushrooms, yeast, and molds that lack chlorophyll. Chlorophyll is the substance that makes plants green. So one big thing that we get in the dental office is what is called oral candidiasis, and it's basically a yeast infection in the mouth. Have y'all ever seen a baby that has thrush? It looks kind of like cottage cheese on their tongue. Well, that's what thrush looks like on babies. But oral candidiasis looks the same way. There's a picture below on 56. It's red. It's painful. And it's got like a white cottage cheese film to it as well. It can be treated with antibiotic, with a mouth rinse, maybe a lozenge that they can suck on, but it can be treated. Most of the time, oral candidiasis happens when someone doesn't take their denture out at night. Patients are supposed to take their dentures out at night, but Mama may not want Pawpaw to see her without her dentures. So she leaves them in all the time. And so it's constantly trapping that moisture, and our mouth is hot, right? So that can cause oral candidiasis. It's like sitting around in the summer with a wet bathing suit all the time. Women can get a yeast infection. So it's basically like a yeast infection in the mouth. All right. So how does it enter our body, right? First, we have an infectious agent. We have an infectious agent, the pathogen, the virus, the fungus, the bacterium must be present in significant numbers to cause the infection. Then our bodies act as a reservoir, right? And so we have what's called port of entry. What are port of entries on our body that infections and viruses can enter?
Your mouth and your nose.
Your mouth, your nose, your eyes. What?
Ears.
Ears, a cut, your vagina, your anus, anything with a hole. Okay? Point of entry and point of exit. Charlie! Sorry. Okay. Hey. Okay. And then transmission is the mechanism that the pathogen uses to spread from one host to another. All right. Page 57. Numbers refer to the concentration of pathogens that are present. The more pathogens that are present, the better the chances of overwhelming the host and producing the disease. Do y'all wear a mask when y'all go out? Or did y'all stop doing that?
I do.
I do. And the other day I ran into the gas station real quick and I forgot, and I was like I freaked out.
There's still a lot of places that won't even let you in without a mask.
Yeah, which I think is great. I mean, it's still out there. It is still out there.
I do think that, the media makes a bigger deal out of it than it really could be, but still kind of scary.
It is. It is. I mean, but also with the heat now, especially in Texas, it will be interesting. I mean, of course, the numbers have gone down, but it will be interesting come the fall to see if it rises its ugly head again in full force. So it will be interesting. But yeah, I wear a mask. I mean, I don't wear gloves, but I wear a mask. because you never know what someone has. So, like a friend of mine was telling me that they knew someone that had it, and they were just going out like it was nothing. I was like, what? Why? So, but it's the same with the flu. You know, people go to work with the flu, and then you come home and everybody has it, you know. So, but I think I'll always wear a mask now, especially if I ever go on an airplane again. I'm definitely wearing a mask. Would y'all go to the movie theaters right now?
Yes.
Yeah? Would you take hand sanitizer with you?
No.
Mm-mm.
Okay. Well, to each their own. To each their own. Yeah. All right.
Because I know they'll have the hand sanitizer at the end of the walk-in, in the beginning of the walk-in. They'll have hand sanitizers.
Well, you would hope so. You know, you would trust that, kind of like us as dental assistants. When our patient comes into the office, they expect everything to be sanitized, right? So it's called standard precaution. So you're hoping that everyone is using that standard precaution. But what if there's that one lazy employee and they just wipe down every other chair because every other seat was open? Does that make sense?
Right.
Like, I don't think right now you can go to the movie theater and sit together and as a maybe as a family, but I think it's like every other seat, maybe. But I want them to wipe down every seat. Yeah.
Yeah.
What if my seat is uncomfortable and the seat next to me feels better? I don't know.
That's
So,
very
yeah,
true.
standard of care. I want them to wipe down everything. So, no, I would be taking hand sanitizer. All right. Chronic infection. Well, I'm sorry, acute infection. Acute infection symptoms are often and usually appear soon after the initial infection occurs. So, a cold. If I had a cold right now and y'all were in my classroom and you came to me the next day and you said, "Oh, Miss Knepfler, you gave me your cold," it doesn't work that quickly. It usually takes a few days for it, of course, can enter your body, but until you start showing symptoms, it's typically about 24 hours or 36, you know, it's usually a day or two. It's not, you woke up the next day. You probably got it somewhere else and it was just going around. Okay. And how a cold usually lasts about 2 to 3 weeks. Chronic infection, one that is present for a long, long time, like HIV. That is a chronic infection. It's always there. A latent infection, like a cold sore. If you have a cold sore and it goes away, it's laying latent until something causes it to come to the surface again, like stress. High fever. Opportunist infection means it goes from bad to worse. So if someone had a cold, it could turn into pneumonia. So also known as autogenous. About how long this chapter is. All right. So direct transmission and indirect transmission. So if I had a cold sore and I walked up and I just kissed somebody, that is direct transmission. Okay. Someone has AIDS and they go and they have sex with somebody, that is direct transmission. Okay. Indirect transmission would be if I had a cold sore and I coughed and I touched my table and then someone came and touched my table right afterwards and then coughed, that's indirect transmission, also known as cross-contamination. So when we're in a room and we're working on patients and the doctor's like, oh, I need extra cotton rolls, you would take off your glove. They have what's called an overglove. A lot of offices do have them where it looks like a full food handler's glove, the clear plastic. Put that over your glove. You can get in the drawer, get cotton rolls out, and then take that overglove off. Or you can take your glove off, completely off, if you don't have overgloves. And then you're going to use an instrument to get out the extra cotton rolls. But make sure that that instrument stays to the side and never goes in the patient's mouth. It's just to get stuff out of drawers. Because we do not want to do cross-contamination. In fact, I might add a really cool video for y'all to watch. I think it's still on YouTube. It's called If Saliva Was Red. And there's no words to it, but it really makes you think about, oh, wow, if saliva was red. And it would show like working in the patient's mouth and then touching your ear, and your ear would be red because, yeah. So it's really, really interesting video. So I'll see if I can find it. And then y'all can watch that video. All right. Are y'all good with what the difference is between direct transmission and indirect transmission?
Yes, ma'am.
Okay. All right. Droplet infection. Splash. Splatter. When we're suctioning in the mouth, we're using the large suction, the high-speed suction. And that's going to help cut down on aerosol that's going to be coming back out of the mouth. That's why when y'all start extern, you have your PPE. I mean, face mask, face shield, your safety goggles, lab jacket, gloves, because we are trying to avoid any of that splash and splatter. Have y'all ever taken a hose and like sprayed off a sidewalk? It's flat, right? Well, our teeth are flat. So what happens? It splashes back at you. So that's why we use the high-speed handpiece. Or the high-speed, or the large suction to help cut down on some of that aerosol, known as the droplet infection. And also, too, I did say handpiece, the high-speed handpiece. That squirts water, too. When they're drilling on the tooth, water is cooling down the tooth while they're drilling. If there wasn't water, the tooth would get hot and it would damage the pulp. So there will always be water coming out when they're drilling out decay and working on the teeth to cool down the tooth. Bloodborne transmission. Certain pathogens referred to as bloodborne are carried in the blood and bodily fluids, or infected individuals can be transmitted to others. Bloodborne transmission occurs through direct or indirect contact with blood and other bodily fluids. Improperly sterilizing instruments and equipment can transfer all blood-borne diseases. That's why we use a sterilizer and sterilize instruments between each patient. A lot of people think that, oh, I get a new like each patient gets a new instrument. No, That's not the case. We sterilize each instrument between each patient. Transit bacterium, okay? Transit bacterium enters the bloodstream and causing the temporary presence of bacteria in the blood is called transit bacterium. Transit bacterium, what it can do is it affects the heart. So if somebody had a pacemaker, an artificial knee, anything artificial in their body, when they go to the dentist, when the dentist is drilling, the bacteria in the mouth gets stirred up and it goes into the bloodstream and it settles around the heart and can cause an infection around the lining of the heart. And so those patients that do have pacemakers, artificial, like a hip replacement, they will be pre-medicated 1 hour before the appointment with 4 antibiotics. So that's why it's very important that we always go over health history. When we see the patient, we'll always get blood pressure and go over health history. It will show in their chart if they needed to be pre-medicated. And we always have to ask, did you take your pre-med? If they said no, then we have to reschedule them because we cannot work on them. They have to have 4 antibiotics an hour before their appointment. So, anybody have to do pre-med when they go, like a heart murmur or anything for the dentist?
No.
Vanessa, you left the meeting? It just showed me Vanessa left the meeting. Is that right?
Her phone probably died.
Oh,
Yeah, she's on her phone.
okay.
Let me see.
Yep, it shows that she left. Okay, maybe her phone died. All right, hepatitis. There are at least 5 types of viral. Hey, Vanessa. I thought you left us. So viral hepatitis, there's at least 5. There's hepatitis A. That typically comes from poop. Okay. So after you go to the bathroom, make sure you wash your hands. You don't, in restaurants, you always see in the bathroom, employees, please wash your hands. Yeah. And then changing a baby's diaper, make sure you wipe your hands. So hepatitis A is typically through poop. All right, hepatitis B, y'all have been vaccinated for hepatitis B. Okay. If you have not been vaccinated for hepatitis B, your employer, once you get hired, they have 10 days to offer you the vaccine. Okay. By law, they have 10 days to offer you the vaccine if you don't already have it. There is not, you don't have to do a booster. There's not a booster for hepatitis B. Once you get vaccinated, you're vaccinated. Also, if you want to check to see if your hepatitis B is working, you can get a blood test and see if the antibodies are still in the bloodstream. But with hepatitis B, it's 3 rounds of shots. You get your first shot, say today's June 9th. So I get my first shot today. Then exactly a month later, I get my second shot. If I wait a month and 2 weeks, 3 weeks, I have to go back to the first shot. Then after the second shot, The third shot is 6 months later. If I wait 7 months, I have to go all the way back to the first. So when you get your hepatitis B, you have to always be right on schedule for it to actually work. All right. Hepatitis C. There is not a vaccine for hepatitis C. It affects the liver, so the patient will look jaundiced. The color of their eyes will be yellow. You know, the white of her eyes, it would be yellow. And it is a bloodborne. It is transmitted through blood. They can give medicine to help with the symptoms, but it will never go away. Once someone has hepatitis C, they'll always have it. It's almost like getting HIV. They'll always have it. Hepatitis D is covered under your hepatitis B vaccine. And then hepatitis E, that's if you go to a foreign country and you're like drinking water from the same place people are bathing, cows are swimming, you know, not very healthy water or food. Foreign countries. All right. So, you know, HIV. So HIV is the beginning stage. Well, someone has HIV, and then under unfavorable conditions, their white blood cells drop real low. They get pneumonia. They get really sick, and their T counts go down. It can turn into full-blown AIDS. But it is amazing how many medications are out there for HIV to help patients. If when you're going over someone's health history and they say that they have HIV, I wouldn't ask them, "Oh, so you have HIV?" You know, just and don't act any different. Don't put on 2 sets of gloves. Don't put on 2 things of mask. Okay? Because we're going to treat every patient like they have HIV. Okay? Or COVID. Same thing. Universal precautions. Herpes. There's herpes 1 and herpes 2. How I remember which one is which is 1, and then I point down to the south. 2, buckle my shoe. So herpes 1 simplex is on the lips. It's a cold sore. And it's known as HSV1. And then there's HSV2, and that would be on your privates. Okay? Now, if you had a cold sore on your lip and you had oral sex, you can give your partner 1 becomes 2. Pretty scary, the thought of that, huh? Yeah. So, be careful. All right. Also, herpes zoster, chickenpox is also known as herpes. Did y'all know that? It's herpes zoster. So shingles and chickenpox. Now on 62, I want to go back to herpes 1. Okay. if your patient puts on their medical history that they have herpes, don't ask where. Just, unless they have a breakout, and that's where I'm about to go with this on page 62, where it says state board. On state board, it will ask what is the one virus that a dentist can reschedule a patient for. I don't know exactly how it's going to be worded, but it's going to say, talk about a dentist not seeing a patient that has a virus. Okay? It's going to be herpes 1. It is highly contagious. Highly contagious when it's at that oozy point. So when he's working in the mouth and he's got his gloves on, the minute he comes out, he needs to take those gloves off, not touch anything else. Because then you touch it, I mean, it's highly contagious. So that is the one virus that a dentist cannot see a patient for. Okay? And you're going to have, on state board, it's going to have A, B, C, right? A, B, C, D. So it's going to have HIV on there. It's going to have like A might be HIV. B might be HZV. And then you'll have HSV1, HSV2. So just remember, 1, 2, buckle my shoe. Okay. Any questions?
No.
No. Okay. TB, we talked about that earlier. Tuberculosis, which is caused by a bacterium. TB is the leading cause of death worldwide. It is airborne. Like I said, it is airborne. A patient who is diagnosed with the signs that's described. Guys, give me 1 second. I'm sorry. Hold on. Okay, I'm back. Sorry. Okay. So if you look in the box on 62, productive cough lasting longer than 3 weeks. Sputum comes out of the mouth in productive coughs. Sputum is that thick mucus. Unexplained fever, fatigue, and night sweats. Unexplained weight loss. And members of the high risk group. Who would be a member of the high risk group?
Older people?
Someone with HIV.
Oh.
Yeah. Someone with HIV. And, yeah. Their immune system isn't as good as ours either. Yeah. And someone younger. Good. So it is airborne. Legionnaire's disease. Legionnaire's disease was discovered when a bunch of war veterans, went to Philadelphia and they went to a conference at a hotel. Well, after the conference, all these men from all over started dying, and they couldn't figure out what they were dying from. And so CDC, of course, working on this and working on it, come to find out The air conditioner unit on top of the hotel had broke down for a few days, and repairmen got it up going. Well, when they did, the bacteria that was sitting in the, kind of like in the water from the condensation from the air conditioner went back out into the air. And so some people got sick, some people didn't. People that didn't even go to the conference were dying. And it's because they were walking past the hotel and the droplets were falling. So the guy that discovered it decided to call it the Legionnaire's disease. So in our operatories, in every office, in each operatory will be individual water bottles. And that helps cut down on biofilm that is in the water lines. And we'll go over that again in chapter 6 or 7, I do believe. But you can see what biofilm looks like from water on the bottom of 63. Not the person's tongue, but the one next to it. So bacteria is biofilm taken from dental unit water lines. And it's almost like that slimy, gross stuff on rocks in a lake. That kind of, it's not very, it's pretty gross. So, so that's why water filters, all that good stuff is used to help cut down on biofilm in water lines. Tetanus, which is also known as lockjaw, is very dangerous and also a fatal disease, and it's caused by spore-forming bacillus found in soil, dust, animals, and human feces. I do recommend, guys, to get a tetanus shot. It's good for every 10 years because you never know what's going to happen if you accidentally poke yourself with an instrument. I've done it. I have done it twice. But I do recommend getting a tetanus shot. It wouldn't hurt.
Oh, that sounds like I'm gonna have to take that.
Why?
Because at work I hit myself a lot and I cut myself too. So
Yeah. I would. It wouldn't hurt. I mean, you never know. It's summertime. You're walking around. You might step on a rusty old nail. So it's always good. I do it just to do it, to protect myself from getting,
it's called a what again? Tech?
Huh?
What do you call it again? A tetanus shot?
A tetanus shot. It's on 63 at the top. It's got a bullet next to it. You see it? TETANUS.
Yes.
Tetanus shot.
Tet.
And it's good every 10 years.
Does it have any side effects?
Nope.
No.
Nope. Not at all. And I'd rather have a tetanus shot than get side effects from tetanus. I don't want lockjaw. All right. Syphilis. Syphilis is a STD, a sexually transmitted disease. You see the guy, he's got lesions on his lip and tongue. The first stage of syphilis involves the presence of a painless ulcer sore known as a canker, which is infectious on contact. When it occurs on the lip, it may resemble herpes, but the crusting is much darker. Ugh. The second stage, an open sore. The third stage is the latent syphilis, and that can cause death. So, another way to tell if someone has syphilis, like if your patient comes in, right, and you see something on their lip or on their tongue. Now, never ask, right? Never ask. But get out your phones right now and Google syphilis. I want you to look at people's hands. They have blotching on their hands. They'll also have it on the bottom of their feet, but we're not going to see the bottom of their feet, but we can see their hands.
So they'll have like spots on their hands.
You see it?
Yes, ma'am.
Yeah. So if you ever suspect anything, right, I always have a little post-it and I'll put down check patient's tongue right side or whatever, and I'll give it to the doctor. And then that way, and then he may or may not at that point tell the patient, okay, well, I need to prescribe you and this medication because you have syphilis. But if you're wondering if the doctor doesn't say anything, then after the appointment, then in private, ask the dentist, what was that? That way you know. So if you ever see it again, you'll know what it is. Okay? Any questions on that chapter?
No,
Mm-hmm.
ma'am.
Johnny?
Oh man.
All right. Now, like I said, chapter 6, you can watch the OSHA video, and then you'll take that OSHA quiz that is in the very back of your binder behind your notebook paper. It's folded. And who's OSHA for? Who?
Organization Safety Health Administration.
Very good. And who does OSHA protect?
Public.
There we go. I heard it. Employees.
Employees.
OSHA
There you go. Yeah.
protects the employees. They make sure that we have safety in the workplace. Okay. OSHA protects us. So they make sure we have our gloves, all our PPE. If we ever got stuck, if you ever got stuck accidentally, there would be an exposure control plan. Not an exposure control plan, an accident plan, and it's a binder, and you're going to write down your name, the patient's name, what you got cut with, what you got poked with, and how you took care of it. Everything on that video that is in chapter 6, they are going to go over. Okay. Everything from bloodborne diseases to hand washing. How long should we wash our hands?
20 seconds.
20
10
seconds.
with hot water.
Yep. And when should we wash our hands? Before
When you pick
and
up something.
after gloving.
Yeah.
Yep. And I don't know if it's gonna. Okay. So if I wish I had a pen in here with me. You know how you have a lid to a pen, and you have your pen. So you would lay, whenever you have a needle, if you do not have what's called a recapping device, you're going to lay the lid down, take your needle and do it's called a one-handed scoop method. Never ever take your cap and your needle and go like this, because now you took the chance of poking yourself. So and that's on state board. How do you recap a needle? The one-handed scoop method. And in clinic, I'm going to show y'all how to load a syringe and how to recap it. Okay. All right. So it's going to go over all that wonderful stuff with you on the video. Okay. And your exposure control plan and your MSDS sheets, they're going to explain those to you. Anytime we have a chemical, it goes in a book. It's called the MSDS sheet that would come with the, say, formaldehyde. And we would take that sheet and put it in the binder, any chemicals. And it tells us if we got it in our eye, how do we take care of it? Now, there is a question on two questions actually, on test A and test B. An eye wash station. It will ask, where's your eye wash station located? For us, it's going to be up in the lab. And what it is, it's your regular sink, right, where you wash your hands, but it has these little spouts. And it's got little green rubber lids that go on it. But if you needed to flush your eyes, you pull the green rubber lids off, and it shoots up water and it flushes your eyes out. That's known as an eye wash station. Also, it will ask about your OSHA manual. Your OSHA manual, everything, if OSHA comes in and says, where's your OSHA manual? It would be in the front office. Okay. Any questions?
No, ma'am.
Okay. All right. So again, chapter 5 and 6 tests are open for today only till midnight. And chapter 5 and 6 are due today, exercise and workbook for both of the chapters. All right.